There's also Medicare only to Medigap. So sometimes you find people who are Medicare only who didn't make a decision because they're healthy or for whatever reason. And when they're Medicare only and they didn't get a Medicare Advantage plan or a Medicare supplement, sometimes we find this to be the hardest person to service or to sell. Clearly, they're not overly concerned with health, or they're skeptical of insurance in general because they made that decision. They didn't have the prior proper planning that goes into getting health care coverage. So we find that when we do write them, they're more likely to cancel. But we're always going to try to help and get them set up if we can. Often too, if they're Medicare only and they're showing interest in Medicare supplements or Medigap, to me it's always a red flag that they may have some health issues already that are going to bite you in underwriting. So knowing your underwriting again in the Medicare only to Medigap space, and when you find those people, just be wary that you need to make sure you ask all the health questions as you should always, and prod a little to make sure they don't have any recent diagnoses or anything like that. It is possible that they just kind of delayed for a couple of years and they decided, you know what, I'm getting older, I'm going to get it, and they turn into a great client. But that's just our frame of reference for those prospects typically. Medicare only to Medicare Advantage. So this one's a little bit different because it's benefit driven on Medicare Advantage versus coverage driven. Benefits being, dental, vision, hearing, all that kind of stuff. The maximum out of pocket, the cap is great. Lowering some copays on preventative care and testing, stuff like that can be a huge benefit as well. But Medicare only to Medicare Advantage is a market that we see quite a bit in the annual enrollment period. People coming in, a lot of them have been Medicare and Medicaid, dual special needs, FBD or full benefit dual eligibles. And these people we're often putting on a Medicare Advantage plan, getting them some additional benefits, and just make sure that you're servicing them well. You have some sort of automated service like Thinks.io, sending them cards, automated text messages, asking for reviews, referrals, blah, blah, blah. And the reason is all those touch points, even if there's nothing crazy or even a phone call, which a phone call is always good, you can let them know you're still there. So if they're continuing to get marketed to, they'll come back to you when they're looking at a different product. Okay, Medigap to Medicare Advantage. Now, this one is a little bit. This one is happening more and more for us as we're in heavily marketed in our direct-to-consumer offices in a Medicare Advantage growing market. So we're in a rural market that was high Medicare supplement enrollment or Medigap enrollment, but a lot of these people were very, very poor, and their income really disproportionately is affected by increases on Medicare supplements in comparison to someone who would typically buy Medicare supplement, say in Florida, who's probably middle class and isn't quite as affected by, $30, $40 rate increases here and there. Medigap to Medicare Advantage is when you're going to take one of these people who is paying more than they should on a Medicare supplement and give them the option to look at Medicare Advantage. And we're seeing this happen a lot in people that are really up against a breaking point of not being able to afford their Medicare supplement and not being able to get the price down. Be careful, because some of these people may have cancer or be on kidney dialysis or some sort of treatment that's surely to indebt them to that Medicare Advantage plan's maximum out of pocket in the next year. So you don't want to just put everyone who's paying too much on a Med Sup on a Medicare Advantage plan. Find out about that medical history. Use your medical questionnaire to find out, what prescriptions are they taking. When you look at those prescriptions, you can kind of tell, hey, are you on kidney dialysis? Hey, are you this, and this? You don't have to answer health questions or ask health questions for Medicare Advantage. And they certainly don't have to answer the questions, but it helps us in knowing whether this is going to be the best thing for them. Also, asking their doctors. If you get a clean list of their doctors, you should know off of that whether they have a nephrologist or an endocrinologist or a cancer doctor. What is a cancer doctor called? It's going to come back to me in a minute. Oncologist, right? So Medigap to Medicare Advantage, there's definitely a market for it. Just make sure that when you're doing it, it's for the right reasons. T65 Medicare Advantage. So in T65 Medicare Advantage, these people are turning 65 and they're Medicare Advantage prospects. What makes somebody a Medicare Advantage prospect? To me, it's about being driven to the benefit side versus the coverage side. There's things that people will tell you when you're teeing up the high level concepts of both coverages. Hey, Mrs. Jones, we have this T chart here we're drawing out. Draw a line in the center of your paper, make a little T chart, have Medicare Advantage, Medicare Supplement. And when you start comparing them, you say, on this side, we can go to 97% of doctors and hospitals in the country. On this side, you say you need to stay in network. Sometimes you have to stay in network. Then also show price 0 over here for Medicare Advantage, additional benefits, dental, vision, and hearing over here. On the Medicare Supplement side, does not include dental, vision, hearing. Here's the price. Then you do maximum out of pocket on Medicare Advantage, whatever, $6,000, $7,000. On the Medicare Supplement, $233 or plus $20 copay, whatever supplement you're talking about. When you start comparing them, these people will tell you which one of those they want, and that's already you're pre-closing because they're telling you, hey, I want this Medicare Supplement right here because I don't want to worry about what doctor it goes to. Okay, I don't need to go any further. We can go right into taking that application and pivoting straight into it. But a lot of them will tell you that they're benefit driven. So in the T65 Medicare Advantage world, just make sure that you're getting them the benefits, showing them the potential maximum out of pocket, and then cross-selling hospital indemnity plan with lump sum cancer riders through like Heartland National or somebody, and pairing that over to your Medicare Advantage sale. Also, one we sell a lot is the Aetna Hospital Indemnity Plan with an Aetna Cancer, Heart Attack, and Stroke policy. The reason I like the two separate policies is sometimes through underwriting with the Aetna Hospital Indemnity Plan, they can't get it, but they can then pass just the cancer portion. And the cancer portion for out-of-pocket related to Medicare Advantage can be substantial. If they have a $10,000, $15,000, or $20,000 lump sum benefit that they get when they get cancer, that can go a long way to paying their maximum out-of-pocket over the next year or two related to that cancer treatment. T65 Medigap. So when you get into someone turning 65 who becomes a Medicare Supplement or Medigap prospect, you guys in your Amp Up book, I believe, have our bundling charts or sheets where we talk about the different products at the bronze, silver, and gold stages. With a Medicare, there's a Medicare Advantage and a Medicare Supplement sheet in there. With Medicare Supplement, we're looking at Medicare Supplement, aka Medigap, prescription drug plan, cancer policy, dental, vision, and hearing, and home health care. That's the gold bundle. The silver, you take off home health care, you leave the rest. The bronze, you then take off dental, vision, hearing, and you leave Medicare Supplement, prescription drug plan, and cancer coverage. So even our lowest package, we're recommending the cancer coverage. Very rarely do we have somebody that peels that back down to just the Medicare Supplement and drug plan. Once you position it there as something that you recommend at every level, they typically get it. And most of the time they're picking silver, and you're also getting the dental, vision, and hearing sale as well. So turning 65 Medigap, just make sure that when you're working with those, you're filling all the void. You're talking about dental, vision, hearing, the need for additional cancer coverage, and you're getting their drug plan. Because when you stack all of that coverage up, you're very well covering them, and you're adding more policies in the household, which means you will be more, those clients will be more let's see, not indebted. What would be the word? Those clients would be more likely to stick with you. They're more in your graces, and they want to make sure that they stay there because they have multiple policies. If you haven't heard that before, I'm sure you have. The more policies you have in one household, the more likely that they are to stay with you. Which brings me up to the next point: cross-selling. And sometimes when we talk about cross-selling, some people think, okay, with cross-selling, I have to sell the core product first, and then I cross-sell. Well, I've been in call centers before where someone had an attachment rate on ancillary products well above 100%. And one of the ways they get the attachment rate above 100% on an ancillary policy, that being their ratio of core health plans sold to ancillary health plans, is by selling an ancillary plan, even when sometimes they don't sell a Medicare supplement or Medicare Advantage plan. So let's say you're talking to someone who has a Medicare Advantage plan, they have no special enrollment period, and it's the lockout period, and meaning it's not annual enrollment, it's not open enrollment, and or they have the best Medicare Advantage plan for them, and you don't want to change them because it would be not a good thing to do for them. You can look at, well, let me tell you about some of the holes in there. You educate them on their maximum out of pocket. You educate them on their daily hospital copays. You educate them on what would happen if they had chemotherapy or radiation treatments. And when you educate them on all that, you show them ways to fix that. Well, I can get you this hospital indemnity plan and this lump sum cancer benefit, and that's going to clog up a ton of those high potential holes, right? So cross-selling can be cross-selling someone who is not even a core client of yours yet. It could be something where I'm going to write this cross-sold product and then put you in my CRM, and then I'm going to come back later on and pull cross checks, or I'm going to set an activity for the annual enrollment period to call you and make sure that you have your core plan still with the best one. And if not, then I can write that at that point, still keeping your ancillary policy intact. Same thing can be said for Medicare supplements. Sometimes you talk to somebody with a Medicare supplement, and with that Medicare supplement, they are through underwriting can't get approved. Maybe they have, let's say they have out of control diabetes, right? Or diabetes with high blood pressure with 3 blood pressure pills. Well, you may not be able to rewrite their Medicare supplement to get their costs down, but you might be able to cover them in another need, cancer policy or dental, vision, and hearing coverage. So it's always looking for an opportunity to cover a niche or cover a small issue they may have or a small hole that they may have. That's what selling insurance is all about. It's putting a product in place to cover risk, okay? So cross-selling, don't just think of it as selling people that I sold a core health plan an ancillary or additional benefit. Think about it as cross-selling can be cross-selling somebody that you never sold the original stuff to. But of course, when you're writing the health plan, use your bundling sheets to position yourself to sell more when they're turning 65. When they're not turning 65, you can break it all the way back down into an educational pitch to try to create the need for something they haven't needed yet. Or you could just use capture the savings methods, where if you're rewriting somebody from a Medicare supplement, saving them $70, you position it, hey, I can get you the same Medicare supplement plan you have now, so you have the same quality of coverage plus $10,000 in cancer coverage, and I can still save you $35 a month. Instead of saying I can save you $70, I can save you $35, and I can get you 2 products and still save you $35, right? That's another way we cross-sell. PDP to PDP. Most people are thinking, why would I even worry with that? Well, if you're new and people want your help with PDPs, just look at it as a massive opportunity to present Medicare Advantage to them, or to find their Medicare supplement in the household and rewrite the Medicare supplement. Also an opportunity to get referrals off of them. Also an opportunity to get their spouse or significant others policies or plans. So prescription drug plans for us have become just a big part of doing business, because they help us find other big policyholders. We had a $1.2 million MIGA that we submitted. Now, it was a MIGA, but it was $1.2 million MIGA case that we submitted off of somebody that came in just for their PDP. That was about 2 years ago, 2.5 years ago. It was during AEP, I believe, 2019. So about 2.5 years ago, we had somebody come in and do a $1.2 million MIGA case off of a PDP lead. If I would have turned it away, I wouldn't have got that MIGA case. But more often than that, we see a ton of MedSup production because their other MedSup agent was unwilling to do their Part D plan, prescription drug plan. And the Part D renewals, guys, do add up. Dripping nickels is a real thing.
It's time to grow your agency like a guru. Introducing Go Guru Pro. The Go High Level platform allows for minimizing software-based subscriptions and grants control over several facets of marketing and communication. Automate your workflow, communicate with your leads, book appointments in advance, and house all your clients in one secure location. Visit goguru.pro and schedule your one-on-one demo today.